My name is Katie Brooks. I'm a licensed clinical social worker, EMDR certified therapist, and approved consultant. I'm also the clinical director and founder of Good Therapy San Diego, which is a group practice with 3 locations in San Diego County. Last video, I talked about Flashforward procedure. So this video, I want to talk a little bit about what comes after Flashforward, which is the mental video check and in vivo exposure. But before I do that, I want to delineate the difference between mental video check and future template. They're very similar, and I want to make sure that there's no confusion about when and how to use both. So a future template is a part of EMDR's 3-pronged approach that focuses on building confidence and skills to cope with future challenges. The mental video check is a more detailed process where we create a mental movie of ourselves dealing with an anticipated event, and it's used generally after Flashforward procedure. So before we get into mental video check and in vivo exposure, let's just do a little refresher course on future templating. So you can use future templating in one of 3 ways: as resourcing during your 3-pronged approach, like in basic training, and also symptom focused. Let me give you an example of what that might look like with a case. So let's say you're doing developmental work with someone that has had trauma with their mother and is afraid to go home for the holidays. A way that you might use future templating for resourcing would be to have your client imagine what it would feel like to go home after you finished your work together, especially if you don't have time to reprocess all of the past experiences and you're pretty new to working with your client. It might be a helpful exercise to see if your client can even imagine not experiencing a negative Christmas or even a positive Christmas. It's slightly an assessment as well, but it's also laying the groundwork for future goals. So what you would say is, let's imagine how you want to feel when you go home after we finished our work together. And your client might say something like, I want to feel joy, I want to feel peace, and some semblance of love. And you would say, and what would be the positive belief that goes with that? Your client might say something like, I'm worthy. And you would say, okay, go ahead and imagine yourself in that scene at Christmas with your family around you with the words, I'm worthy, and those feelings of joy, peace, and love. You got that? Okay. And then you would apply slow BLS. And when they're done with the 8 to 12 passes of BLS slow, ask them what came up for them. There might be a blocker in the beginning to even doing this exercise. Don't panic. That's just information for you that those positive neural networks are pretty hard to access at this point, and your client doesn't even think that it's possible. So talking to your client about how imagining something is not necessarily meaning that it's going to happen. Imagining it just opens up your brain to the possibility that something positive could happen, or even something neutral could happen, and that it's a worthwhile exercise. Okay, so the second way you can use future templating is the normal 3-pronged approach that you learn in your basic training. When you go to basic training, they often will teach it, reprocess all your past memories, reprocess all your present triggers, and then you reprocess your future templates. Well, that's all fine and good when you're doing work with somebody that has not a lot of developmental trauma, but let's just say somebody with complex PTSD comes in. Most likely, you're not going to get to those future templates for a really long time. So what I have found to be more effective is actually doing future templates along the way. So in this example, you might reprocess a past negative experience with your client with their mother, the present trigger, and then the present trigger of seeing mom. And then you would go right into the future template of going home for Christmas, especially if it's coming up. So the last way that you can do future templating is symptom focused. So let's say that your client does not want to process the past, does not have the stability needed to go into the past, or does not have the time. Let's say Christmas is right around the corner. Yet you know she still has to go to Christmas and she's experiencing intense anxiety. You can process the present trigger or the future fear and provide a future template in order to improve functioning. So most likely your SUD will not clear, but your client will feel better moving into the situation. So let me give you an example of what the verbiage would be for a traditional future template for this exercise. The present trigger was spending time with mom, and the future template is going home for Christmas. So what you would say to your clients would be, imagine the future situation of going home with the positive belief of I'm worthy. 1 to 7, how true does that feel to you now? 7 is the most true and 1 is not at all. If 7, install the positive belief and have your client run a movie of going home with the positive belief of I'm worthy. If your client is not at a 7 or has trouble running the movie without disturbance, you will want to apply fast BLS and skills until you reach a 7, and you can also run the movie with the positive belief in mind. So that is a traditional future template and how you would do that. So let's move on to mental video check. Like I said, it's different than future templating in that it's mostly used after the flash forward target has been cleared and before you apply in vivo exposure. And we're going to talk about both. So reminder, in our last consultation, we talked about flash forward procedure, which is when you're processing a future feared catastrophic or worst case scenario. A mental video check is used once you have cleared your flash forward rather than a future template. So what you would do is have your client close their eyes and imagine doing the feared future challenge and coping well. As the client imagines this event, have them narrate it out loud and open their eyes if they hit any part that is disturbing to them. When they open their eyes, apply one set of fast BLS, and then have them continue to narrate their future challenging scenario out loud until they reach the end. Each time they hit a disturbing piece, you'll want to have them open their eyes, apply fast BLS, and then continue their story. What you'll want to do is repeat this until they can narrate their future challenge and imagine themselves coping appropriately without any disturbance. So let me give you an example of what this would look like with a case. So the future fear might be doing EMDR. The flash forward of that is going crazy. So that's her future feared catastrophic event, the worst case scenario. Then you would do a mental video check. So you would say, close your eyes and imagine doing EMDR in our next session and coping well. While keeping your eyes closed, tell me how that would go from beginning to end, like a movie. If you feel any disturbance at all, open your eyes and let me know. Then what you're going to do is apply fast BLS if they open their eyes for one set, and then have them continue their story of doing EMDR in the next session until completion. You're going to repeat this process until they can tell the story of doing EMDR without any disturbance. So that is a mental video check. It's pretty simple, but again, it's slightly different than future template, and it's used after flash forward, after processing the feared catastrophic event. In many cases, especially when you're treating phobias, panic disorder, and OCD, in vivo exposure would be the next step after flash forward and the mental video check. So let me give you examples of what this would look like in a sequence with a phobia, a panic disorder, and OCD, so that you can get kind of a understanding of what the protocol would be if you're treating one of these disorders. So let's say that you have a man that has a phobia of dogs. The flash forward might be something like the dog bites me in the neck and I bleed out, right? Worst case scenario. The mental video is playing with the dogs at the park he goes to, right? So after you process the flash forward, you're going to leave that worst case scenario in the past, and you're going to run a mental video of them going to the dogs and going to the dog park and coping appropriately. And in vivo exposure, after you do the mental video check and they can run the movie of playing with the dogs at their park, you'll do an in vivo exposure. So in vivo exposure might look like watching a video of playing with dogs, right? And then the homework might be something like going to the park and petting a dog. And then the next time it might be going to the park and playing for 1 minute. And then the next time might be playing for 5, and so on. So that would be how you would sequence something with a phobia. Another example is panic disorder. So phobias, panic disorders, and OCD are generally what we use flash forwards with, because there is always a catastrophic doom scenario, usually with these disorders. So panic disorder, let's say you have a woman that comes in with panic disorder and she has a fear of going to the movies. Her flash forward might be something like having a panic attack that leads to heart failure with no escape. The mental video check might be something like going to the movies and coping appropriately with that. And once she clears the mental video check, you'll do an in vivo exposure. So I might have my client go to the movies and sit by the door, and then maybe sit there for as long as she can tolerate until she can sit by the door at the movies for the whole movie. Then I might have her sit in the middle and watch the movie. And then I might have her sit in the front and watch the movie. So you're going to gradually expose her to the feared stimulus. The next example is somebody with OCD and maybe an eating disorder. Those two diagnoses tend to go together. So let's say you have a client that comes in with a fear of gaining weight and a compulsion to overexercise. So the flash forward might be something like being extremely overweight and being ostracized by her friends. The mental video check would be skipping a day of exercise, right? So imagine coping appropriately and skipping a day of exercise, right? You might have her narrate out loud from the beginning of her day till the end of her day, not exercising, until she can do that without disturbance. Then the in vivo might be a little bit tricky in regards to this one, because you can't have her do something in the office. I usually try something in the office first for in vivo. So instead, I might do something like imagine a person that she knows that is not overweight and also does not exercise. I would have her pull up the image of that person, ask her what the positive belief that goes with that person. Maybe she's okay just as she is, or that she is free. And then I would apply slow BLS. So here's this creative thing where I might be doing an imaginal exposure of somebody that she knows that copes appropriately with skipping exercise or does not exercise, and resourcing that and seeing how she does with that exercise. Then I might apply a homework of skipping 1 day of exercise, then skipping 2 days of exercise, and then maybe even skipping 3 days until we come to the end goal of what our collaboratively we've come up with as appropriate exercise for her. So that would be how you apply mental video and in vivo exposure to your flash forward procedure. If you missed my last video on flash forward, I highly recommend going back and taking a look at it. It's extremely effective procedure for phobias, panic disorder, and OCD. And thank you so much for your time. If you have any questions on this, I'm happy to answer any of those that you have at katie.brooks@goodtherapysandiego.com. Our website is goodtherapysandiego.com, and our phone number is 619-330-9500. Thanks so much.